Assalamu alaikum wa rahmatullahi wa barakatuh. I am Amal Fathi and I will talk about mesothelioma. This seminar is supervised by Dr. Karam Turath Agha. Malignant mesothelioma has assumed a great importance because it's highly related to exposure to airborne asbestos. It's a rare cancer of mesothelial cells, usually arising in the parietal or visceral pleura. It also occurs much less commonly in the peritoneum and pericardium. Approximately 90% of individuals with this cancer have 80% a history of exposure to asbestos. This picture shows how the asbestos fiber deposit in the lung. Those who work directly with asbestos, such as shepherd worker, miners, insulator, are at greatest risk. But malignant mesotheliomas have appeared in individuals whose only exposure was living in proximity to an asbestos factory or being a relative of an asbestos worker. The latent period for developing malignant mesothelioma after the initial exposure is long, often 25 to 40 years, suggesting that causative driver mutations are acquired slowly over a long period of time. As stated earlier, the combination of cigarette smoking and asbestos exposure greatly increases the risk for developing lung carcinoma, but it does not increase the risk for developing malignant mesothelioma. Once inhaled, asbestos fiber remain in the body for life. Thus, the lifetime risk after exposure does not diminish over time, unlike with smoking, in which the risk decreases after cessation. It has been hypothesized that asbestos fiber preferentially gather near the mesothelial cell layer, where they generate reactive oxygen species that cause DNA damage and mutation. Sequencing of genome has revealed multiple driver mutations, many of which cluster in pathways involved in DNA repair, cell cycle control, and growth factor signaling. Of interest, one of the most commonly mutated genes in sporadic mesothelioma is BAP1, which includes a tumor suppressor involved in DNA repair that also is affected by germline mutation in families showing a high incidence of mesothelioma. Now we talk about morphology. Malignant mesothelioma are often preceded by extensive pleural fibrosis and plaque formation, readily seen on computed tomography scans. These tumors begin in a localized area and over time spread widely, either by contiguous growth or by diffuse seeding of pleural surface. At autopsy, the affected lung typically is encircled by a layer of yellow-white firm, variably gelatinous tumor that obliterates the pleural space. The neoplasm may directly invade the thoracic wall or subpleural lung tissue, but distant metastases are uncommon. Normal mesothelial cells are biphasic, giving rise to pleural lining cell as well as the underlying fibrous tissue. In line with this potential, mesotheliomas conform to one of three morphologic appearances. Firstly, epithelial, in which cuboidal cell with a small papillary bud-lined tubular and microcystic space. This is the most common pattern and also the one most likely to be confused with a pulmonary adenocarcinoma. Secondly, sarcomatous, in which spindled, occasionally fibroblastic appearing cells grow in sheaths. And third one, biphasic, having both sarcomatous and epithelial area. This picture shows malignant mesothelioma, in which there is thick, firm white pleural tumor that encircles the bisected lung. This is picture show a tumor, a mass of a tumor in a pleura. This is epithelioid mesothelioma and this spindle mesothelioma. وشكرا جزيلا.